Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about peptides. Peptides are strings of amino acids, and generally the ones that we're talking about are between 8 and 20 amino acids, strings of amino acids. And they're naturally produced in the body and for various metabolic processes and reasons. And they have become very, very popular in the treatment of some ailments that we see in tick-borne illness, like insomnia, joint pain, inflammation, immune dysregulation, brain fog. And so we have several peptides that are very good at regulating the problem that you're having. And for example, for gastric upset, we use BPC 157. It works great. For immune regulation, we use TB 500, thymosin, and thymogen, and they work really great as well. For inflammation, we use KPV. For sleep, we use things like DSIP, and dihexa. Dihexa is actually also an oral. It's a tablet you can take, and it really helps you with sleep. And then something called C-Lank and C-Max. Now, most of the peptides that I use are sub-Q injections. And sub-Q injections are just a tiny little needle. You can't even feel it. It's like a mosquito bite. And you inject it into your abdomen and you rotate the place. So bottom left corner, bottom right corner, upper right quarter, upper left quarter. And you generally inject them 5 days a week. And you generally do peptides. I try and do them 2 months on and then give people a month off. You don't want to do them continuously because your body will adapt, and we don't want that. So you can rotate some of the peptides, but you cannot just continually do them because your body will adapt, and then that will be a problem. So we also provide you with a peptide kit and instructions and a video on how to administer a sub-Q injection and how to reconstitute the lyophilized peptide. Lyophilized means that it's in powder form, comes in a little tube with powder, and we reconstitute it with bacteriostatic water. And when you shake it, you don't shake it hard. You shake it like this because peptides are very fragile. And then you store them in the refrigerator. When they're lyophilized, you don't have to store them in the refrigerator, but I would keep them in a cool, dry place. You don't want them out in the hot sun. Once they've been reconstituted with bacteriostatic water, you need to keep them in the refrigerator. And you use an alcohol swab. You swab off the top. You swab off your area on your body, you draw up the amount, which we will give you the instructions for, and then you inject it, and then we also give you a sterile container where you put the used needle in. So you don't just put that in the regular trash. No. It's a biohazard because it's touched your blood. So peptides are a wonderful way to augment your treatment. I think they're wonderful. I'm so excited that we use a lot of them. And they're really easy to administer too, like really easy. So if anybody is interested in peptides, let me know, and we can talk about what we should use and how to administer it. And I think you'll be really pleased. All right, I hope you found this information helpful, and I hope you have a wonderful day. Take care.